Welcome back. And in today's lesson, we're going to talk about vagus nerve stimulation in a little different fashion. So, by now, you already know how powerful the vagus nerve is for benefits in relaxation and energy restoration and overall health. But what you may not know is that you can stimulate the vagus nerve using electrical devices as well. More advanced techniques from what we've discussed already. So this lesson, I understand, may not apply to everyone who's listening or watching, but if you've attempted those techniques and haven't found the benefit that you'd like and want to try something a little bit more advanced, then this information may be for you. So vagus nerve electrical stimulation's been shown to help with stress reduction, mood balance, pain management, and much more. In this video today, we'll explore how external vagus nerve stimulation electrically can work and the type of devices that are available and some significant tips for safe and effective use. So we'll discuss those in more detail now. So what exactly is vagus nerve stimulation, electrically speaking? We've talked about it yesterday in the previous lesson, but this is upgrading that significantly. And if any of you have been to the chiropractor and had a TENS unit applied to your back, that's that electrical stimulator, think of it like that, but very specifically to stimulate this nerve that we've been discussing for the last couple of days. So vagus nerve electrical stimulation is a clinically backed technique that uses gentle electrical pulses to activate the parasympathetic nervous system, specifically the vagus nerve. And it's commonly used to reduce stress and anxiety, and it can calm the nervous system, lower cortisol levels, and all the things that we've discussed already. It's also used for mood enhancement, regulation, shown to help with depression and emotional balance, helps with sleep enhancement, and can promote relaxation and deeper sleep cycles. And some products are more designed for that than others. They can also help to improve gut health by stimulating that gut-brain connection that we talked about yesterday. It can also be helpful and used in chronic pain relief. So conditions like migraines and fibromyalgia. I'm familiar with and have used and prescribed a device for fibromyalgia nerve pain that's like a TENS unit that's applied to the calf for management of those types of pain syndromes. Very familiar with TENS units and these sorts of devices. It's similar to that, but used for this specific nerve. So vagus nerve stimulator devices work by sending a very gentle electrical signal to stimulate the nerve itself, the vagus, and it'll tell your body to relax and heal and restore balance, and that's its purpose. So first, I want to discuss the two kinds of that stimulation so that there's no confusion. There are two main types of vagus nerve stimulators. One is implantable, and we will not be discussing that other than this particular slide. They're implanted under the skin. They're connected to the vagus nerve on the neck. They're used to treat epilepsy and depression and severe neurological conditions. They require a doctor's prescription and surgical implantation. We're not going to discuss that any further. The devices we'll be talking about are the non-invasive devices, which are worn externally. They're either on the ear, the neck, the jawline. You apply them yourself and just clip it on or put it on, and they can stimulate the vagus nerve indirectly. So without a surgical procedure, there's no incision, nothing like that. You don't even have to see a doctor for it. So they're ideal for stress relief, energy restoration, daily relaxation, those sorts of things. No surgery required, highly accessible. They're wearable depending on the type of device that you select, and we can talk about that. So non-invasive devices, they offer an easy way to experience the benefits of vagus nerve stimulation without medical intervention. So I want to discuss in the rest of today's lesson how to use them safely and effectively, because there are some significant tips I want you to do to avoid any issue. And again, if you're not in the market to consider this, that's perfectly fine. You can move along. So how can one use a non-invasive vagus nerve stimulation device? And what are the tips? Well, using a non-invasive stimulator is simple, but proper usage is key to avoid any issues. And that's the most important thing. We don't want to cause a problem, trying to eliminate a problem. If you have questions regarding specifics on the device that you would select, those sorts of things, all kinds of information available on the internet, loads of different devices and different styles out there. And if you're really interested in trying one of these, feel free to reach out to me in the community, ask me some questions. I've had personal experience and used and prescribed half a dozen of these different devices, styles of them. And so they each have their benefits and disadvantage. And obviously cost goes with that too, depending on your price point and what you're looking for. But the first issue would be to choose the right device. So research brands based on your needs and your budget and what you want to try to accomplish with the device. Second, we need to, when you do pick it, locate your stimulation point. So some of them are, and let me point here, are ear devices. You apply it either here on your ear. This is a left ear, and that's what I recommend. It can be used right here on the auricle, on the ear itself, or right here on the tragus, this little flap that's sticking out here. So you can apply it here, you can apply it here. And there are other devices that go inside the entire ear, and I've tried those as well. Zenowell, I think, is the name of that device, and it just fills up sort of your ear canal there. And there are a variety of ways that you can use those, or clips that can be purchased to be used here on your ear as well, and you can move that around. Another type of device is used here on the back of the neck, I should say on the side, right underneath your earlobe, for example. You feel your jawline, and it's applied right through this region. The coolest is that type or variety, and I've got his video on this course as well, and it's applied right here, but you have to hold that device. The other ones are, like putting an earpiece on and it stays in place. And then there are other devices that you put on your neck itself that can go either around the neck in front or the back and stimulate in that fashion. So depending on the device, if you choose one that you select, will determine the most appropriate stimulation point. Those are typically those two spots, the auricular branch, which think ear, auricle is the medical term for ear, or the cervical branch, which is demonstrated here, which is the one going down your neck. The stimulation point will depend on the device that you use. Another important thing, you have to adjust the intensity. Always, always, always start low and move up from there. Again, if you've seen a chiropractor or a physical therapist and they used electrical stimulation or any other device like that with you, they start low and they say, tell me when it's comfortable, and they adjust that dial up to increase the stimulation. Think of it like a volume button on the radio. You don't start with it maxed and turn it down. You start with it low and turn it up. And the same sort of thing with this. You'll feel that stimulation. You don't want to go past the point where it's so intense that it's uncomfortable. So gradually improve that. Next tip, time your sessions. So you don't put it on and say, turn it on, leave it on, and fall asleep. Most of these more modern devices have a timer, and the session is timed. You can only use it for so long. I recommend no more than 15 minutes of a daily session. It's effective then for relaxation and energy balance, and the location and duration of those sessions is dependent upon the device. Some you can change it and some you can't. It's a set amount of time. I find it's also helpful to incorporate this with breath work, which we'll talk about in more detail tomorrow. So slow, deep breaths can also enhance not the function of the stimulation, but the amount of activation you get for your vagus nerve. Most people that use this or have, they report feeling much more calm, more focused, more energized within minutes of using a device like this. And again, because this is a new sort of thing that most people are not familiar with, I'm going to go over some of those safety tips again, just to make sure that I've got all the bases covered for you and it's safe and effective. And the safe part I want to key on here for vagus nerve stimulation. So these are pro tips to stimulate effectively and safely. Start slow with low intensity. Because some of them you can change the intensity or the setting, but don't overstimulate it. You'll be uncomfortable. Start slow and build up gradually as comfort permits. Next would be use consistently. Attempt to use daily. It'll provide the best long-term benefits. And once you reach that threshold where you're getting the benefits, you can taper back and do an every other day if you'd like, or only as needed sort of thing. You pair it with breath work, as I mentioned previously, you'll get a deeper, better relaxation. It's a great time then to do your stretching, your relaxation, breath work, all of those sorts of things go together. You'll get a much deeper relaxation. We got to check for medical contraindications. So if you have a pacemaker, an electrical heart condition, that you already know about, an ectopic node, for example, you've got a ventricular or an atrial fibrillation issue, you've got electrical conduction issue to your heart, you have to consult your doctor first. Certainly if you have a pacemaker or any other electrical implantable device, I do not recommend using this at all. So if you have an open wound near the site of the stimulation, that's a no-no, or any other medical condition. You want to make sure that you check with your physician first, your healthcare provider first, a cardiologist first, if you've got those issues. Otherwise, it's a contraindication. You can't go there. Listen to your body. Stop and reduce the intensity if you feel dizzy or you're uncomfortable or you're getting stinging or you're getting nerve pain, zingers, shooters, feeling like electric shock and that sort of stuff. It's too high and it's too intense. It needs to be turned down or stopped altogether. But when correctly used, vagus nerve stimulation can be a game changer for relaxation, for stress relief, and for overall well-being. Now, I understand that vagus nerve stimulation, electrical stimulation may not be for everyone, but if this has caused you to be curious and you're interested in pursuing this, it is an exciting tool for improving your relaxation, your mood, and your energy levels. So whether you use vagus nerve electrical stimulation or pair it with natural activation techniques like we talked about in the previous lesson, stimulating your vagus nerve can really help to restore balance and calm and vitality to your life. So I find that with vagus nerve stimulation, in a couple of minutes, in the first 5 minutes, you usually feel a calming effect. It tones things down, makes you feel more centered and focused. And consistent use over the course of the first 2 weeks definitely starts to impact your life in a positive way outside of those stimulation moments and times. And the majority of users, close to 3/4, report a feeling of significantly reduced stress and better sleep as a result. So it's a powerful stimulation tool, but certainly not for everyone. And if you found this video helpful, or certainly if you have other questions or concerns, want to give it a try, but you're not sure, reach out to me in the community, ask others about their experiences or thoughts about vagus nerve stimulation, look it up, check with your physician, etc. But there's lots of information out there, loads of different devices. Reach out to me if you have questions. Thanks for watching. Don't be nervous and give it a try.